Without objection.
Thank you, Mr. President. I rise today to talk about the taxes that are in this bill, and taxes that are imposed in 3 weeks. Not 3 weeks from 6 months from now, not 3 weeks from 2014, 3 weeks from January 1 of 2010. 3 weeks from now, January 1, 2010, we are going to see the taxes in this bill start. Now, I know people are saying, but wait a minute, this bill doesn't take effect until 2014. That's what we've been talking about, it's what we've been hearing, but no, the tax part starts in 3 weeks, January of 2010. I have partnered with Senator Thune, who has been working on this problem, Senator Grassley, Senator Hatch, and many others who are going to be speaking today. And I see my colleagues from Florida, Nebraska, Wyoming, as well as my colleague, Senator Crapo, from Idaho, all of whom, and Senator Crapo, of course, is waiting for an amendment on, a vote on his amendment, which would stop the taxes on everyone who makes $200,000 or less. So we're talking about the taxes because it's such a huge issue. But here is what is going to happen with the taxes in this bill that start in 3 weeks. Americans will pay more in insurance premiums, Americans will pay more in prescription drugs, and Americans will pay more for medical equipment. Let's walk through those taxes. In a few weeks, in January of 2010, $22 billion in taxes on prescription drug manufacturers, $19 billion in taxes on medical device manufacturers, and $60 billion in taxes on insurance companies. That's around $100 billion that start in 3 weeks. And then in 2013, the taxes on high benefit plans take effect. That's $150 billion in taxes. So every union member that has a really good plan that gives them the benefits that they have negotiated for over the years, those taxes come in at 40% of the premiums. That starts in 2013, but you're still saying, now wait a minute, I thought the bill started in 2014. That's right, but the taxes start in 3 weeks, and they keep right on going, and in 2013, the high benefit plans start getting a 40% excise tax. Mr. President, when the $100 billion in taxes start in 3 weeks on drug manufacturers, medical device manufacturers, and insurance companies, what happens? Premiums go up immediately. Prescription drug prices go up immediately. The medical devices, the hearing aids, the things that people need for their medical treatments go up immediately. So we've been talking about reform, healthcare reform, the need for healthcare reform, the need to make history, and yet the reform that we're going to see go into effect right away is huge tax increases. So I'm here with many of my colleagues who are so concerned about this for their constituents, and I would just like to ask the senator from Wyoming. The senator from Wyoming is one of the 2 physicians in the United States Senate, and he has been so active in this area. And I would just say, when the taxes go up on our insurance premiums, our prescription drugs, our medical equipment, I would just ask the senator from Wyoming, as a physician, what do you think is going to happen to the costs of health care?
Well, I have great concerns.
Senator from Wyoming is recognized.
Thank you very much, Mr. President. I have great concerns about the cost health care for American families. And we see it with our seniors, certainly, as they are seeing Medicare cuts, is what we've heard from the floor here, $464 billion of Medicare cuts. but also the taxes that are going up that are going to impact on all people of this country. And I remember a promise that the president made, and he said his plan won't raise your taxes one penny. He went on to say, if they're not your income taxes, payroll taxes, capital gains taxes, any of your taxes. But we're seeing here that taxes are going up, and in a way that is basically, you hate to say it, but it's a gimmick. That's a gimmick in this bill. A gimmick where they're going to collect taxes for 10 years, but only give benefits for 6, and it's the last 6 years. So even though, as my colleague from Texas said, they're going to start collecting taxes, today's the 10th, on the 31st of this month, 21 days from now, they'll start collecting taxes, but the services won't be given for 4 years. That's how they get the number under $1 trillion. And yet it's at a time when the president makes his statement, well, this won't add a penny to the dime to the deficit. 80% of the American people don't believe it because they know what's in front of them. They know how they have to live their own life, and they know what it's like. So I'd ask the senator from Texas, is this what you're seeing as well?
The senator from Wyoming brings up the point because the president said in his address to the joint session of Congress that this bill had to come in at a cost of no more than $900 billion. And so the CBO scored the bill at $847 billion. But the senator from Wyoming has brought up the point that that's because they started scoring the bill in 2010, but the costs in the bill don't start until 2014. So if you take the 10 years from 2010 to 2013, or 2010 to 2019, it probably comes in at $847 billion. But if you start when the costs start at 2014 and go to 2023, the cost is $2.5 trillion. I would just ask the senator from Nebraska if his constituents from Nebraska are hearing this $2.5 trillion cost. Half of it is coming from Medicare cuts, not half, but about a quarter of it's coming from Medicare cuts, about a quarter of it in new taxes that start next week. What are the citizens of Nebraska saying about this?
Well, Mr. President, the citizens of Nebraska are absolutely on to this gimmick. They've got it all figured out. They know it's a gimmick. Here's what I would tell the senator from Texas. I had an opportunity, as you know, to be their governor for 6 years. Every year, I had to walk in front of the unicameral, our one-house system, and give a State of the State address and lay out a budget plan. And had I walked into that chamber with a budget plan with these kinds of gimmicks, they would have been rolling in the aisles laughing at me. I mean, literally. They would have been rolling in the aisles. And then the people of Nebraska, I'd always do a state fly around where I'd go community after community talking about my budget vision, talking about my legislative package, et cetera. Well, the people of Nebraska would have run me out of the state had I tried to balance the state budget based upon this kind of gimmicky approach. And Senator, you have absolutely hit the nail on the head. What you have here is a situation where those who wrote this bill, as we all know, it was written behind closed doors. Nobody knew what this bill was until just a few weeks ago. But those who wrote this bill said, oh my goodness, the president has said we've got to bring this bill in under $900 billion. That's what he said. How are we going to get that accomplished? And so they used gimmicks. They put the revenue, they uploaded the bill, front-end loaded the bill on the revenue, so that starts right away. But then the benefits of the bill don't start for 3 or 4 years. And so, whoa, magic. We've made the bill come in under $900 billion. But let me just offer this thought. Who loses on this? Who loses on this crazy accounting gimmick? Well, you know who loses? The constituents that we represent in the United States, not just Nebraska, because they're going to pay the taxes. They're not going to see the benefits. It's like buying a car and paying on it for 4 years, but not getting the car for 4 years. They're going to pay on it. And then sadly, and most concerning to me, is that this gimmickry is going to get passed on to the next generation. Because when it doesn't work, somebody has to pick up the bill. And the full cost of this bill, we've come to recognize, is $2.5 trillion. And this bill just doesn't fit together. It doesn't pass the smell test, as we say back home in Nebraska. My hope is that sanity will revisit what we're doing here, and people will say, time out. We can't ask the American people to go along with this. We've got to call a timeout, and we got to get this right.
The senator from Nebraska, and I think his view, having been a former governor, is especially important here because what we've heard in the grapevine, we haven't seen any new proposals, but we've heard that there's going to be an expansion of Medicare and an expansion of Medicaid. Medicaid in particular is going to be very costly to states because they have a requirement, a matching requirement for Medicaid, and many governors are concerned about that, and I know the governor from Nebraska and his background realizes that that's one of the biggest issues in a state budget. And I know that the senator from Florida also has experience with being in a governor's office, being a chief of staff for a governor, and he has been very active, especially because the population of Florida has a very high rate of senior citizens, and the cuts in Medicare in the bill before us are huge. So he's on the floor, and I'm just wondering, when you're looking at the cuts in Medicare and you're looking at the huge taxes, how that's going to impact the state of Florida and how you think we're going to have to deal with that.
Well, I thank the senator from Texas, Mr. President. This is budget gimmickry. And like the senator of Nebraska, I didn't serve as governor, but as a chief of staff who had to work on trying to balance a budget because our Constitution in Florida requires that, you know, we'd sit around and we'd try to figure out how much revenues we had and then how much we could spend. And if there weren't enough revenues, we either had to cut spending or find a new source of revenue. There weren't any other choices. We couldn't engage in this budget gimmickry. And I like, if I may borrow from my friend from Nebraska, the analogy of the paying for a car for 4 years before you get to drive it. I mean, this is really what we need to tell the American people. Imagine you're going to buy a substantial purchase, a house or a car, and they show you the house and they say, here's what your mortgage payment's going to be, and you're going to live in the house for 10 years. Start paying today, but you can't move in until 2014. That's what this bill does. So in order to make this quote-unquote budget neutral, we steal $500 billion from Medicare, health care for seniors, where seniors have paid in. We raise taxes, which is going to increase, not decrease, the cost of insurance. When we tax pharmaceutical companies, when we tax the providers of medical devices, what happens? They pass those costs right along to the citizens. So not only are we stealing from Medicare, not only are we raising taxes, which is going to get passed on to citizens, now we're going to tell the states we're going to increase Medicaid. And we're hearing this secret deal that's been put together behind closed doors. You know, now at least we're getting some friends that are in the dark, because now a lot of the Democrats apparently don't know what's going on either. And they're scrambling around trying to figure out what the deal is. But the deal is apparently going to put more of a burden on the states. And I want the American people to understand, and I know that my friend from Nebraska knows this, being a former governor, is that when you increase Medicaid, the states pay the vast majority of that, and they're going to, because they balance their budgets, they're going to have to cut something else. So they're going to have to cut teachers, or they're going to have to cut law enforcement. So we steal from seniors, we steal from the states, we raise taxes, We don't cut the cost of health care for most Americans. You know, I'm new to this chamber, and perhaps my friend from Idaho can help me understand this, but this doesn't make a lot of sense as to how we should proceed with health care reform.
Well, no, it doesn't, and I appreciate the comments of my colleague from Florida, all of my colleagues here on the floor today. As the senator from Texas indicated, one of the items of business before us today is my motion to commit this bill back to the Finance Committee to take out the taxes that the President pledged would not be in there. The President pledged that no one who makes less than $250,000 as a family or $200,000 as an individual will pay any taxes under this bill. And yet, in the very first 10 years, there's almost $500 billion of those taxes, a huge portion of which falls on people who are in that category. And as has been indicated, the real implementation of the bill on the spending side doesn't happen until 2014. If you count the amount of taxes that start when the spending starts, it's about $1.2 trillion of new taxes. And really the only thing that's transparent here, because this was all crafted behind closed doors, the only thing that's transparent is the gimmick. The President said, as the senator from Texas pointed out, that he would not let a bill come across his desk and get his signature if it spent more than $900 billion. Now, first of all, you have to say, wow, why do we need almost $1 trillion of new spending? But when they went behind closed doors and came up with this bill, it turned out that it cost around $2 or $2.5 trillion. And so how did they make it meet the $900 billion test? Well, they just said, well, look, let's just delay its implementation for long enough that the number comes out to be under $900 billion. That happened to be the year 2014. And so if you don't count the first 4 years and only count the 6 of the 10, then you can, in this budget window we're working in, you can get your number. It's just remarkable. Before I ask the senator from South Dakota about his perspective, because I know he's working with the senator from Texas on an amendment to try to correct this gimmick, I'd just like to respond to one quick point that I know that our opposition on the other side has continued to make, and that is they actually say that there are no tax increases in the bill. How do they say that? Well, here's the way they say it. There are subsidies in the bill that are provided to people with low income who don't have adequate access to insurance. Those subsidies total about $400 billion in the bill in the first 10 years, which is really only 6. And they count those subsidies as a tax cut. The technical term given to them is a refundable tax credit, although $300 billion of those subsidies don't go to taxpayers. The people who receive them do not have a tax liability. But then they offset those subsidies against the taxes that the rest of America will pay and say, therefore, there are no taxes in the bill. I think that's another form of gimmickry. But I would ask my colleague from South Dakota what your perspective is on the types of gimmicks that we are seeing here and whether the American people should insist that these kinds of things be removed from the bill.
Mr. President, I would say to my colleague from Idaho that I support his amendment, and I hope we get a chance to vote on it. I know right now they're scrambling to try and find an alternative to put up so that they can have something to give their side political cover, because they know, and the reason they're trying so hard is they know that this raises taxes. I mean, to say with a straight face that this doesn't raise taxes, the American people get this. I mean, I think the gig is up. They figured out that there are huge Medicare cuts in this bill, huge tax increases in this bill. And as the senator from Idaho pointed out, when they say that these refundable tax credits are going to go back in the form of premium subsidies and that there aren't that many people who are going to pay, as you pointed out, 73% of the people who will get those premium subsidies are people who don't have an income tax liability already. And so therefore, it's hard to say that you're going to reduce taxes on somebody who doesn't have an income tax liability. But more importantly than that, there are still 42 million Americans with incomes under $200,000 a year, according to the Joint Tax Committee, who are going to see their taxes go up under this. So you've got literally millions and millions of Americans under $200,000 a year, and as you mentioned, the President's promise was he wouldn't raise taxes on anybody over $250,000 or under $250,000 a year. This just flatly contradicts that, flatly violates that pledge. And I can't fathom anybody coming here with a straight face and saying, oh yeah, this doesn't raise taxes. Of course it raises taxes. Now, what the senator from Texas and I have decided to do in our amendment, if we ever get a chance to vote on yours, and I hope yours succeeds, and if it does, we'll go back to the committee and figure all this out. But we also offered an amendment that we think makes sense, or a motion, I should say, because it aligns or synchronizes the dates of all this. What has happened here is, in a very, I would say, deceptive way, they have understated the cost of this bill. And my colleagues who are on the floor right now have alluded to this, but they tried to get it under $1 trillion. And in that attempt to try and get it under $1 trillion, they had to come up with some budgetary gimmicks. Now, just to illustrate that with a bar chart, you can see in the first 10 years that this bill, starting today and going to the year 2019, the spending in the early years doesn't show up much. Well, that's because most of the spending gets put off until January 1 of 2014. And so if you look at that first 10-year period, the spending under the bill is less than it will be when the bill is fully implemented. When the bill is fully implemented, you look at the years 2014 to 2023, it explodes, the spending in the bill, from about $1 trillion over the first 10 years to $2.5 trillion over the 10 years when it's fully implemented. And the reason they were able to do that is because of this sort of smoke and mirrors way of delaying these tax increases, or I should say enacting the tax increases immediately and delaying the spending. And so the American people are going to end up spending $71 billion in tax increases out of their pockets, out of the American taxpayers' pockets, or about $600 per taxpayer, before they ever see a benefit under this bill. So what the senator from Texas, Senator Hutchison, and I are offering is a motion that would delay the tax increases until such time as the benefits begin. That, to me, would seem to be a fair way to go about making public policy. What they have done in an effort to obscure the cost of this, the overall cost of this, is to say that 22 days from now, we're going to raise your taxes. January 1 of this year is when most of these taxes on prescription drugs, taxes on medical devices, taxes on health plans, all the taxes in the bill begin to take effect January 1 of this year. So for the next 4 years, people are going to be paying taxes out of their pockets. And I might add, because of the taxes that are going to go on all these device manufacturers, prescription drugs, health plans, will get passed on in the form of higher premiums. So they're going to see tax increases and premium increases before they ever see a dollar of benefit. It's 1,483 days until the benefits under this bill kick in. That, Mr. President, is unfair. It's unfair to the American taxpayer, it's unfair to the American people, and it's unfair to, I think, try and obscure and mask the total cost of this bill and say, well, we're only spending $1 trillion on this, when we know full well that when it's fully implemented, the total cost of that is $2.5 trillion. And so I appreciate the discussion that's being held here and pointing out the smoke and mirrors, sort of underhanded way they're trying to shield the cost of this, but also to support the senator from Idaho with his amendment that would recommit this bill and get these tax increases out of here, because the one thing that the small businesses in our economy are saying right now is we want to invest, we want to create jobs, but you can't raise taxes on small businesses when you want them to create jobs, and that's what this bill does. Now, the National Federation of Independent Business, the Chamber of Commerce, National Association of Wholesalers and Distributors, all the major business organizations have come out opposed to this. And the National Federation of Independent Business, in a letter yesterday, said, you know, we don't support policies that increase the cost of doing business and that raise taxes. And clearly, that's what this bill does. So our amendment, our motion, I should say, is very simple, and that is it just simply delays the tax increases until such time as the benefits begin. And
I'm very pleased that the senator from South Dakota talked about what we're trying to do, because it's very simple. It's very simple. The Hutchison motion to recommit says, if we do nothing else in this bill, we have to be fair and transparent with the American people. And that is, we don't start the taxes. We don't start the increases in premiums, increases in prescription drug benefits, increases in medical devices, until at least there's an implementation of this program that we hear is going to be offered to the American people. We haven't seen it, but we're told that there's going to be a program that Americans can sign up for but they're going to be paying higher taxes and premiums and costs in health care for 4 years before they ever see it. And all we're saying is, let's send this bill back to committee and fix that. It does not, as the senator from Nebraska said earlier, it doesn't pass the smell test. It doesn't pass the smell test in Nebraska or Wyoming or Florida or Idaho or South Dakota or Texas to tax people for 4 years, to raise their costs until they basically are going to say, give me an alternative. And the alternative is, guess what? A big government takeover of our healthcare system. That's like saying, I'm from the federal government and I'm here to help you. We've heard that before. I don't think the American people will in any way believe that this bill is fair or honest with them if we start the taxes 22 days from now, as the senator from South Dakota has pointed out, but they don't see a program. They're going to go online and they're going to say, oh, my premiums are going up, my prescription drugs are going up. My goodness, where's the program that they've been talking about? Oh, they're going to go online, but hey, there's no program. Now, how can we go home? I would ask any of the senators who would like to add their perspective on this, how are you going to go home and tell your constituents that your taxes start in 22 days, maybe in 4 years, roughly, maybe you're going to see a program, and we're from the federal government. We're here to help you.
Well, you can't go home and say that with a straight face, because the people at home, and we're all many rural areas in our states, the people see through all of this. 2 articles next to each other in today's New York Times. One talks about the details of the secret agreement that they're working on behind closed doors, and it says details are scanty. And right next to it, it talks about for rural elderly, times are distinctly harder. And these are for the people that are going to see taxes going up. These are for the people who are going to see the cuts in Medicare. I just want to read the first paragraph because this is from Lingle, Wyoming, a community in my state, and it talks about Norma Clark, 80. It says she slipped on the ice out by the horse corral one afternoon and broke her hip in 4 places. Now, I'm an orthopedic surgeon. I've taken care of many of these over the years. Alone, it took her 3 hours. These are the kind of wonderful Americans we have. Alone, it took her 3 hours to drag herself the 40 yards back to the house through snow and mud after she had stabilized the injury. Now, this is a person who's on Medicare, and they're going to cut $464 billion from Medicare, and they're going to use gimmicks that are going to harm our people. And I have a former governor here, a chief of staff for a governor's office. You know, in the rural parts of your community, Governor, and now Senator from Nebraska, you have people like that, hardworking people who expect honesty from a government, and they're not getting it in this bill, which is going to tax for 10 years and only give services for 6.
You know, that is such a compelling story, and I want to add something to that. When you think the policy could not get more crazy and insane, you hear about this idea that you're going to expand Medicare, which is due to be insolvent in 2017. But the tragedy of that, in relating it to the story you just told us, is this. That will hammer our rural hospitals. Why? Because they can't stay open on Medicare reimbursement rates. They cannot stay open on Medicaid reimbursement rates. So this poor woman who dragged herself to try to get some care all of a sudden could be faced with the possibility that the hospital that she relies on will not stay open under this health care bill. And I've been to those hospitals. I've seen the struggles that they are going through with Medicaid reimbursement and Medicare reimbursement, and every hospital administrator tells me the same thing. We would close our doors if we had to live on that. So what's their solution here? Expand Medicaid and Medicare. You got to be kidding me. Who are they listening to? You know what? Take this bill out to the rural areas of Nebraska. You'll get an earful.
Time is left on our side.
You have 7 seconds. 4, 2, 1, 0.
No,
Time
that-
has expired.
That was not on our side. Let me just give the last 5 seconds to the senator from South Dakota.